Today is Thursday, May 11th. We'll tell you what happens starting today now that the COVID-19 national and public health emergencies are coming to an end. Also, how authorities are getting ready to respond to a surge at the southern border, and why some Republicans are calling attention to the Biden family's financial records. Plus, what FDA advisors decided about over-the-counter birth control pills that could lead to a major change. How AI is being integrated into dozens of additional tech products. And a reason to say thank you to a teacher or a nurse this week. Those stories and even more news to know coming up. Welcome to The Newsworthy. All the day's news in around 10 minutes. Fast, fair, fun, and on the go. I'm Erica Mandy. Thanks so much for being here. You ready? Let's do this. Today marks a new era in the COVID-19 pandemic. Exactly 3 years and 100 days ago, the Trump administration declared COVID-19 a public health emergency. And today, the Biden administration is letting that emergency declaration expire. To be clear, this does not mean COVID-19 itself has gone away, but it does mean the situation is no longer considered an emergency in need of all the extra federal resources to deal with it. And with that, some healthcare perks are going away too. For example, free COVID-19 tests are no longer guaranteed. Most insurance companies will still cover the PCR ones, but a lot of Americans will have at least some out-of-pocket costs now. Fewer insurers will cover the at-home tests. And today is the last day to order more from the federal government through covidtests.gov. As far as COVID-19 treatments go, like the antiviral drug Paxlovid, they'll still be free as long as the federal stockpile lasts. Once that's gone, though, how much you pay at the pharmacy will depend on your health insurance. A few other changes. Hospitals and freestanding ERs will no longer get higher Medicare payments for treating COVID-19 patients. They'll also no longer be able to set up overflow space in parking lots if needed. And state health departments and labs will no longer be required to report COVID-19 data. But a lot has changed since the public health emergency was first declared. The CDC now tracks the spread of the virus by examining wastewater. The nation's medical reserve is better stocked with hundreds of millions of N95 masks, billions of gloves, and about 150,000 ventilators. And the branch of the Health and Human Services Department that handles things like test and vaccine distribution is now better staffed. One of the biggest changes that comes from ending the COVID-19 public health emergency is happening on the U.S.-Mexico border. Title 42 is coming to an end. And that's the policy that's been letting border officials turn away most undocumented adults right away without processing them or giving them an asylum hearing, all in the name of public health. And now that it's ending, the number of people lined up at the border is growing. But migrants are going to be facing new rules instead. A key one is, to enter the U.S. and apply for asylum, people first have to apply online and seek protection in a country they've passed through on their way. And if they cross the border without doing those things, they could face more serious criminal consequences like deportation and a 5-year ban on re-entering the U.S. This new rule comes into effect today, but the federal government also has some ideas to open up legal asylum pathways. For example, more than 100 migration hubs are opening in several countries where people can apply to go to the U.S., Canada, or Spain. Families who cross the border will face curfews and monitoring, like with ankle bracelets. And the U.S. plans to increase deportation flights. The new way of doing things is facing some criticism from both sides. Some Democrats and immigration advocates say the regulations are too harsh and that they go against asylum guarantees in U.S. law. Whereas some Republicans want even stricter rules, like renewed efforts to build a border wall. Lawmakers in Congress are talking about their own immigration solutions now. Stay tuned. Congressman George Santos is now facing 13 criminal charges for fraud, money laundering, and theft of public funds. Specifically, federal prosecutors say he stole from his campaign, lied to Congress about being a millionaire, and cheated his way into collecting unemployment benefits. Santos has admitted to misleading voters in the past, but he says he did not commit any crime. He pleaded not guilty on all the charges and said the accusations against him are politically motivated. Santos made it clear he will not be stepping down and will keep running for re-election. But things could change if he's convicted of the charges he's facing. If found guilty, Santos could face up to 20 years in prison. House Republicans say they've uncovered some suspicious details about President Biden's family and their finances. They released records that seem to show $10 million in foreign payments to members of the Biden family. The chairman of the House Oversight Committee, Congressman James Comer, says the president's relatives used the family to enrich themselves and that President Biden was involved. That said, the report does not go into how Biden may have been involved, since none of the payments shown were actually to the president. And at this point, they don't show that he may have been influenced by the payments either. The report in itself also does not accuse anyone in the Biden family of anything illegal at this point, just suspicious. Though this investigation is not over. In fact, Comer says it's widening. In response, the White House is calling the whole investigation a political stunt. And lawyers for President Biden's son, Hunter, say the report was full of, quote, repackaged misstatements of perfectly proper meetings and business by private citizens. This also all comes as Hunter Biden is under federal investigation. A grand jury is looking into his taxes and foreign business work and will reportedly make a decision about whether to charge him in the next few months. Americans who have been struggling with price increases are starting to see some relief and some setbacks. The closely watched Consumer Price Index report came out this week. The CPI, as it's called, measures what we pay for goods and services. And this latest report shows cheaper prices for things like groceries, including eggs and produce, airline tickets, and new cars. But prices still went up for gas, used cars, and rent. Overall, the CPI climbed 4.9% in the year through April. That is down from a peak just above 9% last summer, but still higher than the 2% yearly increases that were normal before the pandemic. All right, we have much more news for you still coming up, but first, this episode is sponsored by Wondery's new podcast, Think Twice. Michael Jackson was one of the most influential pop stars of all time, but his legacy is tainted by accusations of sexual abuse. Since his death in 2009, the world has struggled with how Michael Jackson should be remembered. As an eccentric cultural icon, a global humanitarian, or a monster. In their new podcast, Think Twice, Michael Jackson, journalists Leon Neyfakh and Jay Smooth delve into the complicated and unresolved legacy of the King of Pop. Through dozens of original interviews with people who watched his story unfold up close, Think Twice reveals a new perspective on his artistry, his controversies, and how we should remember him. Follow Think Twice, Michael Jackson on Audible or the Amazon Music app. The first ever over-the-counter birth control pill could be coming. A panel of independent experts decided in a unanimous vote the FDA should approve a birth control pill called Opill to be available without a prescription. The FDA usually takes the advice of this advisory panel, though it doesn't have to. Supporters of this change point to the overall effectiveness and safety of birth control pills, more options for women, especially those without health insurance, improved family planning, and preventing unintended pregnancies, especially as abortion has been restricted in some states now. Groups like the American Medical Association have actually been calling for over-the-counter contraceptives for years. That said, the FDA did have some concerns leading up to the panel's decision. For example, the agency pointed out there wasn't enough representation of younger adolescents in the company's study to make sure they would use the drug safely and correctly if it was over-the-counter, and whether people could really evaluate their own medical conditions without a doctor's guidance to decide whether they could safely use the pill. But ultimately, the advisory panel decided the benefits of this outweigh the risks. Next up, the FDA is set to make a final decision this summer. As expected, artificial intelligence was the star of the show at Google's Developers Conference this week. The tech giant now says it's going to embed its latest AI technology into 25 different products. The Google search engine will add AI-generated responses at the top of the results pages, and people will be able to ask follow-up questions. Also, AI will be able to help people write emails in Gmail. It will help people edit images in Google Photos. And in workspace apps like Docs and Sheets, people would be able to use AI to change the writing style to be more professional or casual. And those are just a few examples. Google already released its Bard chatbot a couple of months ago. It's the one that's meant to compete with the popular ChatGPT. And yesterday, Google made it accessible to more people, ending the waitlist restrictions. By the way, this comes just 1 week after Microsoft also removed the waitlist from its competing Bing chatbot. And it has also announced plans to incorporate AI into its Microsoft 365 software. MTV News is signing off after 36 years. The news division of MTV will shut down as part of the latest round of layoffs from parent company Paramount Global. It's the end of a news outlet Gen X and older millennials turned to in the 90s and early 2000s as popular correspondents covered music, pop culture, politics, and more. But the popularity of MTV News did not last. This week, former MTV News correspondents like Kurt Loder and former MTV VJs like Carson Daly chimed in with their memories of working there. It looks like Disney Plus and Hulu will merge into just one app by the end of this year. Disney CEO now says the one app experience will mean the general entertainment content on Hulu will become available on the more family-friendly Disney Plus. It's part of a strategy to entice both subscribers and advertisers. That said, all of Disney's streaming options, so Hulu and ESPN Plus, will still be available on standalone apps as well. Note that with this change, though, Disney says it plans to bump up the price of its ad-free plan on Disney Plus later this year. Well, that's it for the main news today, so now it's time for Thing to Know Thursday. But first, a message for our sponsor, Rothy's. If you've been listening for a while, then you know I am a big fan of Rothy's shoes. And it's for a lot of different reasons. One, I can buy new shoes anytime I want to upgrade my wardrobe, knowing that Rothy's shoes and bags are all sustainably made, so I can feel good about it. And they've been designed with the planet in mind. I mean, Rothy's has repurposed over 158 million single-use plastic bottles for their signature thread. And my Rothy's will last me a long time since they are always so durably designed. Two, they are comfortable. It always amazes me that I can wear Rothy's shoes right out of the box without worrying about blisters. And I'm still wearing the very first pair of flats I bought years ago with no issues. Three, Rothy's knows style. They have lots of options, and I always know that whatever I buy will look chic for pretty much any season. So re-energize your spring looks with Rothy's vibrant shoes and bags, and you'll likely add to the 45,000 five-star reviews and counting. For stylish and sustainable shoes, shop Rothy's, and you can get $20 off your first purchase at rothys.com/newsworthy. That's ROTHYS, rothys.com/newsworthy. Okay, now back to Thing to Know Thursday. Well, this is the time to recognize and honor the teachers and nurses in our lives. Teacher Appreciation Week and National Nurses Week are overlapping right now, and they're especially important this year as the U.S. deals with shortages and frustrations. Groups of both teachers and nurses have gone on strike this year to demand better working conditions and higher pay. Some school districts and healthcare facilities are working with them on improvements as lawmakers around the country have come up with their own ideas. This year, more than half of America's governors, both Democrats and Republicans, have called for teacher raises. Even more have endorsed new school safety measures. For nurses, some state lawmakers have proposed setting minimum requirements for nurse-to-patient ratios. Others are talking incentives, like a new Georgia law will repay nurses' student loans. But really, it's not just about money, resources, and working conditions. In surveys, nurses and teachers say respect and appreciation would go a long way, too. So on this Nurses Week and Teacher Appreciation Week, all of us can consider writing a card, buying a gift, or even just saying thanks. All right, thank you so much for listening and being here today. We'll catch you up on more news to know tomorrow. Until then, have a great day.